Imagine a retired librarian named Ellen in Tennessee, sitting at her kitchen table, staring at a pile of medical bills she can't quite cover. Her arthritis meds are eating into her pension, and she's not alone. Millions of Americans are asking, can I afford to stay healthy? Welcome to Health and AMP, Social Welfare in U.S. 2025. Policies updated 04/01 today. We're diving into the systems shaping every life in this country, from healthcare to welfare, at a time when they're under more strain than ever. With costs hitting $4.5 trillion a year, that's 18% of our GDP, according to the Centers for Medicare and AMP. Medicaid services and over 70 million folks over 65 needing more care amid rising inflation. It's a tough scene. But on April 1st, 2025, the Trump administration's second term rolled out bold updates, dubbed Practical Prosperity, promising cheaper drugs, expanded Medicare options, and revamped welfare rules for Ellen. It might mean affordable insulin, though 25 million still lack insurance, per Kaiser Family Foundation estimates. These changes aren't just numbers, they're personal, touching patients, doctors, and families like a single dad in Detroit wondering if his kids' lunches are covered. Today's the checkpoint to see what's working and what's not. Whether you're a policymaker, nurse, or just someone paying taxes, we'll unpack 4 key policies, their impacts, and the road ahead. Because health and welfare aren't abstract, they're about us. Right now, in 2025. We're all in this together, so let's get started. First up, the policies driving this shift. The administration's dropped 4 big updates as of April 1st, and they're shaking things up. Let's break them down. Number 1. Medicare Advantage Expansion. The goal here is simple: give seniors more choices by leaning harder into private plans. By 2025, 40% of Medicare enrollees are in these Advantage programs, says CMS, thanks to new public-private partnerships. It's about cutting costs and boosting options. Think more plans with dental or vision, but critics say it might leave rural folks like Ellen with fewer local doctors if private companies cherry-pick profitable areas. Next, drug price cap legislation. This ties prices for key meds like insulin to inflation rates. A vial that cost $100 last year could drop to $35 now, huge relief for patients, though drug makers argue it'll slow new treatments hitting the market. Third, state welfare block grants. Instead of rigid federal rules, states get lump sums to spend as they see fit. Think flexibility for local needs. But there's a catch, some way. States might trim benefits to balance budgets. Finally, telehealth standardization. One reimbursement rule for all insurers, making virtual doctor visits easier to bill. It's a win for convenience. But rural clinics need pricey tech upgrades to keep up. These policies aim to save money and modernize care, but they're not without risks. So, who's feeling these changes? Let's zoom in on the people, our stakeholders. Start with patients, folks like Ellen. She's thrilled her insulin's cheaper. But if a local clinic cuts back under Medicare Advantage shifts, she might wait longer for a checkup. Telehealth helps she consume her doctor, but only if her internet's reliable. Then this healthcare providers, doctors and nurses. Standardized telehealth billing's a breeze. But new Advantage rules mean more people work up front, and some rural practices are stretched thin. Dr. Patel in Kansas told us he's seeing more patients online. But hiring staff to manage it's tough. Insurers, they're juggling tighter drug price margins with new telehealth profits. Some are expanding virtual networks, others grumbling about lost revenue. And low-income families like Jamal, a single dad in Detroit. Block grants might let Michigan tailor welfare to his kids' school meals. But if funds run short, he's back to square one. He says, I just need something I can count on. These updates are mixed bag, some wins, Some ways and every story is different. Now, let's talk challenges and opportunities, because rolling out big ideas like these isn't smoothing. First, the hurdles. Funding. The beast states say block grants don't stretch far enough, and rural areas, where 15% of Americans lack decent health care access per the Health Resources and Services Administration. Feel it most. Political pushbacks. Real two blue states are digging in against welfare changes, slowing things down. Access gaps persist. Think spotty internet killing telehealth dreams in the countryside. But there's upside too. Opportunities are knocking. AI is stepping up. Picture smart diagnostics catching diseases early. Private companies might fill gaps, like telehealth startups partnering with clinics. And if we nail implementation, virtual care could reach millions more. It's a tightrope. Balance equity and efficiency. And we could see real progress stumble, and the divide grows. So where does this leave us? Let's wrap it up. These April 1st updates: Medicare expansion, drug caps, welfare grants, telehealth rules promise savings and choice. Patients save on meds, providers get modern tools, and states gain flexibility. But the risks linger. Rural gaps, funding fights, and 25 million still uninsured remind us perfection's a ways off. Long term, we might see a leaner system, with costs down and tech up, or deeper divides. If access falters, looking ahead, it's on all of us: policymakers tweaking laws, providers adapting care, citizens pushing for what works. Health and welfare aren't set in stone, they're ours to shape. Think of Ellen, Jamal, Dr. Patel. They're counting on a system that bends but doesn't break. So as 2025 unfolds, let's keep talking, collaborating, and building toward a future where health and welfare mean security for everyone. That's Health and AMP, Social Welfare in US, 2025. Policies updated 0401. Thanks for joining me, and stay tuned for what's next.